outcomes. So there is a lot of negative indicators when it comes to maternal nutrition in the country. That is why such webinars have actually been crafted to ensure that the right information on nutrition, the right information on taking care of yourself as a pregnant woman or taking care of your family or a loved one as a pregnant woman is actually actualized. So we are going to have questions. If you have questions on pregnancy nutrition, on taking care of yourself, dietary adjustment during pregnancies and why it's necessary, kindly feel free to leave them in the chat box. Because we want this to be a very interactive session where we are addressing what is out there. So there's a lot of studies that have shown the impacts of conducting nutrition education sessions, targeting specific indicators such as maternal nutrition indicators and childhood nutrition indicators in outcomes and prevention of the impacts or the defects that are associated with deficiencies during and after pregnancies. So feel free at home. And yeah, questions are welcome. And back to you, Joyce.
Okay, thank you, Lilian, for that very good introduction. So I think we'll start off, and that is a good introduction. I think we'll start off with just the first bit of the topic. That is basically, let me try and get it. Yes, so the importance of balanced nutrition for maternal. So I think for today, we'll cater for maternal and child health. Then tomorrow we'll do adolescents and basically different age groups, what to do with healthy eating habits and a healthy lifestyle. So I think just to bring us up to speed, we just want to know what is a balanced nutrition and why is it important during pregnancy and also during lactation. Mumina?
Thank you, Joyce. As I told you, I have a cat, so I was dealing with that situation. So when it comes to maternal nutrition during pregnancy, what is a balanced diet? You know, we have sung the balanced diet so much that people take it for granted. Because most people usually think or associate nutrition consultations or interactions with just being told that they're going to have a balanced diet. But when someone tells you to have a balanced diet, what does it really mean in the aspect of care, especially if you're a mom or a woman of reproductive age who is looking forward to be an amazing mother or to give birth to that beautiful baby? So maternal nutrition is basically a balanced diet when it comes to maternal nutrition is making sure that you are taking care of all the food groups so that it can supply with the necessary macros and micronutrients that you need for nourishing yourself and taking care of the growing baby. Of course, pregnancy comes with increased nutrient needs, and unfortunately, the Kenyan woman has refused to actually embrace the fact that they need to start adjusting, especially when it comes to nutritional and supplemental intake to support their dietary intake. Immediately they discover they are pregnant. In fact, studies have actually shown that women should actually start on these adjustments when they start thinking about now, when you start getting that baby fever, it's time for you to start actually working on your dietary adjustments. So you do this by promoting what we call basics of healthy living, basic principles of healthy living, ensuring that whatever you're taking up is adequate enough for you to ensure that your energy levels, your organs, your body is functioning optimally, like your digestion is well taken care of, your liver is also taken care of to ensure that your hormones are at par, you're managing stress, all these things, so that you can actually be preparing your body for conception and actually just accommodating that baby that you want to have. So after, of course, I usually say that immediately you discover, because there's a lot of data that has shown the defects or the impact of being anemic and getting pregnant. And Kenya is one of those red regions when it comes to maternal anemia and the negative impacts of all these macronutrient deficiencies during pregnancy. Calcium, we have iron, we have folic, and the Kenyan government actually offers, I don't know, it's still there, the free supplementation of IFAS for all pregnant women. And there's also the care process, where it comes to the mom being taken care of in the different stages of her pregnancy. Unfortunately, most Kenyan women avoid the nutrition clinic. They only go to clinics when they want to get the jabs, when they are getting the blood works, and they really, most of them ignore the aspect of going further to see a dietitian unless it's actually a prescribed, of which I think I'm not blaming our other cadres, but we should actually improve coordination when it comes to taking care of the mother, to make sure that we are coordinating well, so that when this mother comes, the first time she's checked on her weight, she's checked on her diet, the dietary assessment is done, so that we can actually see the projections when it comes to outcomes of this pregnancy. I don't know if I've introduced that aspect well. Joyce, you can add in kidogo.
Yes, you've done much justice to it. And we are saying that once a couple, or rather an individual, feels like, or they are planning on starting the journey of pregnancy, they're supposed to ideally visit a dietitian or a nutritionist to just guide them through what a balanced diet is, the importance of a balanced diet, why it's essential to maybe engage in healthy eating habits, healthy food choices, and relate that to maternal health, and as well as the fetus that will be growing in a few months. So basically, they need, as much as they're going to the gyna and OBS, they also need to book a session with a dietitian and nutritionist, just walk the journey with them. It's normally good to start early than to start on the third trimester, where we would have done a lot more when we started from the first day. So I think you've spoken, you've done justice to the question. So I'll just address the second question to you, where we have, we normally talk about IFAS a lot, iron folic acid supplementation. What is the importance of this IFAS, especially during pregnancy? Like, why do we have to go for? When do we start it? And what are the dangers if maybe somebody doesn't start from the first day, and maybe they start on the second trimester, third trimester? Maybe walk with us through why IFAS is important.
Yeah, this is a good question, a very good question, and in good timing. You see, now with the eruption of the social media, like TikTok, you join a live, and then someone is there, they're giving their story. They are 4 months pregnant. They've not started on any supplementation. They've not even started on any forms of clinics, and they are comfortable. Unfortunately, some of them don't know the dangers, because they're not lied to, because they're led with information that is false. Someone who might be leading them might actually believe that the false information is actually true. So you find, like, I'm in a WhatsApp group, and women usually, you'll see a woman saying that I'm pregnant and I'm yet to even go for clinics, and I'm 4 months pregnant. And she's actually very, very comfortable posting that. And I feel very, very sorry, because when you start arguing with them, they bring you the argument that our mothers did not go for clinics early, they were giving birth at home, and they were not having babies with defects. So first things first, IFAS, iron and folic acid supplementation, I think should be made mandatory, but unfortunately you cannot force humans to take supplements, because that is against the human rights. But for the importance that iron and folic acid has on the development and the prevention of the birth defects of these babies, I think women should actually be highly sensitized and highly encouraged to actually go for these clinics immediately they discover they are pregnant. You know, pregnancy tests, the HCG pregnancy kit comes positive with at least 7 to 14 days, depending on the hormonal profile of the woman. You can actually detect you're pregnant between 7 to 14 days, after 7 to 14 days, using the 50 bob kit that is available in the chemist. So immediately you discover you're pregnant, you are already late, not so late, but at least you are late with IFAS, because IFAS is needed from day one, inception of pregnancy. You need an increased intake of IFAS to ensure that you are preventing these birth defects, like the spina bifida, the neural defects, and all that, and all this malformation, like you give birth to a baby with mikono zimeshikana, fingers zimeshikana, all these small defects that can actually be prevented in the first trimester. People ignore the first trimester when it comes to nutrition, because they assume since the pregnancy is not big, the baby is not at risk. But unfortunately, this is where most deformities or birth defects actually happen. So if you ignore this very crucial part of pregnancy, you are not only predisposing yourself to malnutrition, because again, pregnancy comes with a lot of changes. Like your body will experience these hormonal changes. They might bring you, like you may start having food aversions, you may start having dislikes of foods, you may start having preferences of certain unhealthy foods, and you might still be continuing with certain habits like drinking, smoking, or even this shisha, because women say shisha or weed is not harmful. It is very harmful for the baby. Tobacco Act has actually clearly outlined the dangers of smoking tobacco to not even a pregnant woman, to anyone, and it actually insists on pregnancy and childcare. So you have to make sure that you, when you discover you're pregnant, or when you start thinking about, okay, fine, now I want to get pregnant, prepare your body, prepare yourself with iron stores, prepare yourself with IFAS, start taking up the green leafy vegetables. And because again, production has changed a lot, the quality of soils has really depreciated when it comes to nutrients availability, pH, and all that. So you might be eating the same vegetables that your mother used to eat, but you're not getting the same nutrients that your mother was getting, because the quality of food that we have currently in our Kenyan market is very, very different. Even the ones that you're growing at home, because of the practices that have changed, use of pesticides, use of all these things that we use for faster and easier agricultural practices. So when you decide you are pregnant, or you decide you want to get pregnant, that is the best time to start taking IFAS. Of course, women will come and say, oh, there's the metallic taste, I can't handle it. When I was pregnant myself, because I knew I had to take IFAS, so I would actually do it immediately after dinner or before I sleep. And I don't know if I'm fortunate enough, or maybe because I'm a nutritionist, actually did not even face those small complications that women actually face or usually claim to face. Sometimes we fear things. I actually had that preset mindset that I'm going to have so much issues with taking IFAS, but it was not like that. So before someone actually gets you convinced that you don't need to take IFAS because of the metallic taste, because of maybe it will start making you to vomit, try it first. And then if you try it with a dietitian, there are alternatives. So if one brand, there are several brands in the market. If one brand does not work for you, there are different brands that you can try. And fortunately or unfortunately, the government of Kenya actually provides IFAS in a good absorbable and available amounts. So the IFAS tablet that you're going to take is very tiny from the government of Kenya. It's really very small. And you can just put it under your tongue if you don't want to feel the taste, swallow it and take water afterwards. That is usually what I usually advise someone. But for someone who might be having that difficulty, again, there are other products with the same composition, with the same benefits. Just make sure that you consult with the dietitian, because again, you're pregnant. You don't want to start ingesting things that can harm you or your baby, because at the end of the day, what you're looking for is the positive outcome of that pregnancy, to prevent birth defects, to make sure that you're preparing your body for the other phases of pregnancy, when the baby is growing, the increased blood supplies, the increased all these other two small macros and micronutrients.
Okay, great. Now the next question would be, you are seeing a maternal, or rather a pregnant mother comes to your clinic and they need advice. They've started the IFAS, but they now want to walk a journey with a dietitian from earlier from pregnancy. What would be your advice?
Of course, my advice would be, first, bodies respond differently to everything, including pregnancies. That is why you have some women having aversions, some having just been normal, and others like just going overboard. So what I would actually advise this mother, as we work with you through the nutrition management of pregnancy, you need to make sure that we are, because again, pregnancy needs change with trimesters. During the first trimesters, we have the increased needs of the small, tiny nutrients like IFAS, like iron, like calcium, all these small to things that are found in foods that you can take up, like in a cup like this and you take up enough calcium or such, or you take a supplement and it's done. The energy needs or the calorie needs are not so different in the first trimester from what you were used to, unless if you have another underlying condition, maybe you're managing something like HIV or any other condition that requires an increased intake of energy and you're pregnant, you're definitely going to have to up your intake if you get pregnant. But again, if you don't have any other condition, it's just you got pregnant, you're a woman you're active, you have no complications. So I actually you start by, I usually say you start by readjusting your intake, because most women in Kenya find out they're pregnant. They don't plan for pregnancy. Planned pregnancies are not a common thing, especially for firstborns. They are not a common thing in Kenya. So because most women don't plan for pregnancy, when you discover you're pregnant, you might have been indulging in things like maybe you are going out, tobacco use, shisha, all those, like fast food was your thing, you hated cooking. When you discover you're pregnant, now you need to readjust your focus when it comes to habits and nutrition. Like now you need to start thinking, because women will start saying, oh, I was told if I take Guinness or if I take Coke, I will not have heartburn. I will have a smoother pregnancy. I will have a clearer skin during pregnancy. I will have better digestion. There are so many theories that are outside there when it comes to nutrition in pregnancy and outcomes and symptoms and such. But when I'm working with a woman who's pregnant or who's just discovered they're pregnant, of course, you have to work with them depending on their symptoms, their habits, and definitely their choices. Because again, as you work, you tailor that plan for that pregnant woman. Of course, you tailor it with I say Kenya is rich. So let's just, if you can't take, let's say I want you to take meat, you can't take pork, you can't take liver, because liver can have some serious scent or some serious smell, especially for a woman with aversion during pregnancy. They might not be able to. It's a very good source of iron. So you might want this mother or this woman to actually now, maybe you can substitute something like eggs, consider something like maybe greens, you can substitute something like maybe something, just any other iron source. So before you start saying, I cannot supply iron and folic acid, or I cannot supply this type of nutrient because I do not dislike that food, you should ask yourself or your dietitian, what alternatives do I have? Before we even get to supplementation, because supplementation is not just by the way during pregnancy, it is very necessary, because we have established that nutrient supply for most women of reproductive age is limited, and most women of reproductive age are anemic. If you meet like two women and you're having a normal discussion and you start asking them their symptoms during menses or when they're ovulating, most of them will start telling you, I get hot flashes, I get dizzy spells, or sometimes even others faint. Those are the simple signs of deficiency or iron deficiency during pregnancy. So because of that, we need to make sure that we are upping our nutrition intake when you're pregnant. So just have a sit down, work with a dietitian. When something does not work, do not give up, because you need, if it's calcium and you cannot stand milk, there are other alternatives. If you cannot stand omega and I want you to increase your omega-3, there are other alternatives. So kindly make sure that those are the things that I consider. What is available? What is this woman undergoing during pregnancy? What are some of the symptoms of pregnancy? What does she like? What does she not like? What is accessible? And what is she willing to work with? Sometimes you might be telling someone who's not even ready to listen. So I think I think such webinars are so important, because we are, if we successfully get to the masses, we can change the mindset they have about pregnancy nutrition, and we will do a lot when it comes to reducing birth defects, maternal mortality, preparing the woman for childbirth, preparing the baby for even breastfeeding. And anyway, the meats are many. I'm sure, Joyce, you understand them. Maybe you can add on some.
Yeah. I need to go to the next one, because the various myths are about Somebody would say like they want to take maybe a glass of wine, they want to take maybe two beers, maybe they've heard from their friends and whatnot. And maybe somebody would tell you like they took Guinness when they were pregnant and the baby came out well, you know. So we normally say people are different, but we go as per the guidelines. The guidelines stipulate that alcohol during pregnancy will lead to birth defects. And most of these kids or infants with birth defects, their mothers engaged in unhealthy lifestyle, let me call it as such. Because you talked about shisha, you talked about basically tobacco use and alcohol use in any form, whether wine, beer, either liquor, whichever. As long as it has alcohol content, you are sure your baby will have some type of, or you are basically increasing the risks of them having birth defects. So we normally talk about just avoid, if anything, it's only 1.5 years of no alcohol, then you'll be back. If anything, what are the advantages of alcohol anyway? If at all, alcohol basically predisposes you to 6 types of cancers. So you're better yet just avoiding alcohol in totality, especially when you're pregnant. I want us to go to the next question.
And maybe just before we leave the myth, Joyce,
yeah.
And another myth that I hope that I have debunked is that you have to wait until your pregnancy starts showing so that you can go for clinics. Because you have been told that when you're pregnant, you're going to be given preferential treatment. When you register to that ANC clinic, even without having a big belly, you're already pregnant, so you're vulnerable. If someone treats you badly, please remind them, hi, I am 2 weeks pregnant, please treat me with caution. They will understand. Healthcare workers are also humans and they understand. So please, let's avoid that myth, because I have seen it so much. The ones that you have to wait until the 2nd trimester or the 3rd trimester for you to go to clinics, and or you have to start like, I don't need to take supplements. Who said it? My mom did not do that. We need to stop that. That one, if we successfully stop it, we would have reduced the complications in pregnancy by a lot.
Correct. Just to remind our viewers that the chat box is open and free for all. Kindly drop your questions and we will be coming back to them. As well, you can also drop your comments. If you want to chime into the discussion, you can also write down your comments and we will definitely go back and read that and also tackle it as well. So maybe the next question would be, during pregnancy, we normally have comorbidities, or rather mothers are at risk of various issues during pregnancy, whether gestational diabetes mellitus or there's hypertension during pregnancy. How would you tackle that for a patient, for example, who comes with either gestational or hypertension?
Now that is what is called a high-risk pregnancy. So if you are diabetic or you are pre-diabetic and you get pregnant, or if you are obese and you get pregnant, or if you have any metabolic disorders and you get pregnant, you're definitely at a risk of getting this pregnancy-induced hypertension or pregnancy-related diabetes. That is gestational diabetes and hypertension. So for such mothers, because again, you cannot start limiting intake of food for a pregnant woman. So we just focus if it's uncontrolled, the doctor or the clinician will have you on maybe insulin, because again, for pregnant women, there's that a state of insulin resistance, because now your body needs to adjust its hormones so that you can have an increased intake of food to supply your baby. So there's a lot of hormonal changes, and these hormonal changes actually come with they affect food intake, utilization, and absorption. So when you have diabetes during pregnancy, or if you're hypertensive, you need to make sure that every now and then you're checking on your biochemicals, like you're checking on your blood sugars, you're checking on your blood pressure, you have your GPs, or you're somewhere, or someone who can actually take you to hospital if something happens. But during the first trimester, nothing, there's usually not so much complications. Complications usually arise after the second trimester, moving forward to the third trimester when now the pregnancy is like now dominating and the hormones are all over and food intake is also all over. So I usually say we prioritize management of what is putting that woman at risk. If it's hypertension, if it's blood sugar, that of course has to be prioritized so that the mother and the baby is well. And again, because this is a risky pregnancy, you need to work with all these cadres. You work with your practitioner, general practitioner, if possible, because unfortunately most Kenyans cannot afford private gynecologists because it's not so cheap. But what the cover covers, the public cover, what actually covers access to facilities that offer MCH services. And these facilities also have gynas, and they also have specialists who are diabetologists, and they are going to actually help you manage that. So when you that's why it's very important for you to start going to clinic early so that you can be registered and actually be, in public hospitals, if you're not very caught very early, they might start blaming you. It's quite unfortunate, but we are moving one step at a time. So you need to just make sure that you're early enough to this clinic so that if it's identified early, preventive measures can actually be put in place, because cravings again are a thing in pregnancy. And if you have, let's say, diabetes, or if you have gestational hypertension, you need to make sure that you're managing all those very, very well, including your normal intake, apart from the cravings and aversion, so that you control the parameter as well, the blood sugar spikes, the blood pressure, the sodium. And again, doing simple things like going for walks, doing simple things like pregnant women do not even like to be told to do anything. It's not a disease. It's part of life. Eh? It's part of life. You can walk when you're pregnant, if possible. You can have your and of course, when you're doing that, you listen to your body, because I said every woman responds differently. There are women who can go for kilometers and they will not even have any form of swelling in their feet. And there are those women who will just walk like 10 minutes and then they swell. There's a lot of retention because of the burden and such. But if you're those lucky ones who can actually walk, you walk. And if not, you can do other things. You can try doing mild squats here and there as you strengthen your core, your pelvic floor. You can avoid core exercises as much as you can when you're pregnant. You don't need any core exercises. Yeah. I hope I've tackled it, because this one is a risky one. You have to be managed in a clinical setup.
Yeah, so I normally say that nutritionists and dietitians should not shy away from working with OBS-GYN department. Our colleagues at OBS-GYN should have a nutritionist or a dietitian. You would easily walk in one of those clinics and tell them, hey, I'm a dietitian, I'd want to work with you, partner with you. Let me see your clients for you, or let's partner, so that we are able to tackle this maternal health earlier on, and we don't wait for pregnancies that are preterm infants or things like that. So if we are able to work with these various cadres, then we are able to tackle these issues earlier on. And also, once you have a client who is either having gestational diabetes or hypertensive in pregnancy, you should be able to talk to them in terms of diet. So we're looking at whole grain diets, we're looking at lots of vegetables, we're looking at less saturated fats. We're looking at also any form of physical activity as well, so that we are able to manage those sugars. We're able to manage the sugars and be able to reverse the gestational diabetes, because it is very much possible to reverse the gestational diabetes. For hypertension, they should be able to reduce their fat intake. Most times you want to check, are they having lots of saturated fats? Is it a lot of deep fried foods? Is it a lot of calorie intake and less physical activity? So you should be able to also walk them through the journey of what type of physical activities they're supposed to do which ones are good enough and which ones will not bring an issue to the fetus. Maybe just quickly we tackle the remaining questions. Mumina, maybe take us through is maternal obesity, does it affect pregnancy? Because you get there are mothers who are pregnant and they are in the spectrum of either overweight or obese. Maybe under 5 minutes, just tell us what does maternal obesity do for pregnancy and how does it affect?
I don't want to call it maternal obesity. Let's just call it obesity being obese before you conceive.
Yeah.
Because for conception, now the focus shifts from weight management to taking care of the baby and the growing fetus. You as yourself as a woman and the growing fetus. So I'll call it pre-pregnancy obesity and how it affects pregnancy outcomes. Yeah. As you all understand, obesity is has been classified as a non-communicable disease on its own. Not, in the recent past, we used to associate it with other conditions, like it was a causal factor of many other conditions. It still is, but it is currently classified as a non-communicable disease. So if you are obese, you are suffering from NCD. So, and NCD, obesity has various metabolic risks when it comes to anyone. Women, of course, they might be affected more because of the hormonal profile and the risk of getting pregnant. Because now when you get pregnant, when you come to me, I am still expecting you to have some weight gain, That is the unfortunate bit. I still because to ensure that the baby is growing. But of course, if you are obese, I will not be expecting you to gain the 9 to 15 kgs that we expect for a woman with a normal age and weight and such, the normal BMI. If you are obese, of course, I would actually expect you to gain something like 5 kgs so that you don't go overboard. But again, this is dependent on your classification, if it's 30, 33, your physical appearances, your parameters. As you have said, we need to start working with this obs game. As nutritionists, I think that's one of the challenges we should actually pose to ourselves, so that we go visit these people in their offices and tell them, let's have an agreement on how we are going to work and how we're going to manage this our patients and basically taking care of our babies. Yeah. So when that woman is pregnant and she's obese, I usually tell someone not to panic, because some of them will panic. Let's say someone was trying to lose weight. Because I had a client in 2021, she was obese. She got pregnant, and I remember she came and she was like, no, Tanu, I cannot, I've just been trying to lose weight. I don't want to expose my baby to all the risks of obesity during pregnancy. There's the what you have discussed, hypertension, diabetes, and of course the stillbirths and what are this? The low birth weights are very common in women who are obese. For the layman, they will actually wonder, why would a woman who's obese actually give birth to a very tiny baby? Because obesity comes with altered metabolic functions. And this definitely affects how nutrition is being utilized, expelled, absorbed, and all those factors of metabolism. So when I think what we should actually focus on, instead of now starting to manage obesity in pregnancy, we should actually focus on preventing and managing the pre-pregnancy weight, so that we can actually, again, we don't want to sell pressure to these women, because some of them have a lot of hormonal issues. There's PCOS, there's endometriosis, there's a lot of issues that happen to women as a gender. So you want to manage this woman, like understanding where her frustration is coming from, her fears, and then because already now she's pregnant, you cannot start telling her, I want you to lose weight. That we need to share with them, because of course, if the obesity is serious, grade, I think then the option of weight management has to be factored in, like seriously, because we don't want the woman to die because of getting pregnant. At the end of the day, we want to take care of both the baby and the mother. We don't want to lose any of those. And as healthcare workers, we should actually do whatever we can to make sure that we are protecting and promoting their health status as much as we can.
Okay, cool.
That's obesity in pregnancy.
Yeah. So I think obesity during pregnancy, we are not mostly looking at the weight of the mom. So we don't want any weight reduction. That is not our main goal. But what our main goal would be, no more weight increment in terms of bad healthy practices. So the weight that will be added is from the fetus growing and not necessarily from the diet. So you want to talk them through healthy eating diet such that we are not adding unhealthy type of weight. So again, Mumina, try and keep it under 5 minutes. We want to address the questions as well. So maybe a few questions as we finish this is, so why is iron, folate, and vitamin D, as well as calcium, important during pregnancy, and how can they be maintained through diet?
Nutrition of waste and such for the mother, with the mother and the baby. So you need to have an increased blood volume is needed, and that is where iron comes in. Of course, for the folic acid, it has been associated with a lot of birth defects, the deficiencies of folic acid in pregnancy, like spina bifida, the neural defects, the deformities, all these to malformation problems that are common in pregnancy or common in new babies born from women who are deficient during pregnancy or did not take care of their nutrition status and dietary adjustments during pregnancy. And for calcium, you need it for bone formation because the baby is still growing. You still need to make sure that you're maintaining yourself as a woman, you're not losing teeth, because unfortunately, women think it's normal for them to lose teeth when they're pregnant.
Surely.
Unfortunately.
Yeah.
It's quite sad. That's a deficiency sign, eh?
Yeah.
Pregnancy, you should be getting all plumped up, because you're protecting your body for preparing for childbirth. So all to prevent the deficiencies of calcium, to ensure also when you're giving birth, to prepare yourself for childbirth, because in Kenya tunasemanga mimba haibebwi kwa tumbo, inabebwa kwa mgongo. Because women have actually normalized malnutrition such that they're okay with having back issues after pregnancy, after childbirth, because they're okay with being deficient, which all this can be prevented with proper nutrition care, regardless of it's your first, your second, or your third baby.
Yeah.
So you can actually prevent the effects of deficiency like calcium, back issues, losing teeth, weak nails, by making sure that you adjust your lifestyle habits. So from diet, I've talked about the iron and folic acid sources. We have the plant and the animal sources. We have the green leafy vegetables, the skuma, the terere. Unfortunately, the quantities or the numbers might be a bit low. So if it's possible, you can always supplement. And then we also have heme sources. That is basically the animal sources. We have meats. We have all types of meats. We have the eggs, the ova. And of course, when you're taking iron, you need to make sure that you're also protecting and taking care of the medium of absorption. So you're taking care of the meal combination, the food groups, and what are you taking? If I'm taking meat, you can take meat. You can take meat. You take with mboga. You take with ugali, and don't drink tea. When you're working, tea is our favorite African beverage. It's mine, definitely. So, but it has tannins that actually bind iron in food, and it actually forms compounds that make it impossible for the iron to be utilized by your body. So you might be taking good iron sources, but you're actually limiting absorption and utilization of those iron sources by your meal combination. Another thing is the medium of absorption. It needs an acidic or what we call in layman's word sour medium for effective absorption. That is basically from vitamin C rich foods, because they are known to be sour. So you can take after your meals. If you're pregnant, you can start loving orange, or try as much as you can to lean towards loving orange. I've seen a comment on pineapple. There are articles, because I've not seen a conclusive study on how it induces labor. But again, you don't want to be one of the subjects for those conclusions. So you can just take them in moderation. Things like dates. Dates are very good sources of iron, but again, when your blood supply is actually needed the most, I think that's when women are actually encouraged to take dates. That is basically during the 3rd trimester. And for that, again, there are also articles that have actually shown that dates improve or induce labor, or they make women actually go into labor fast. So women in their last month should actually increase their intake. I also think that's God's way of telling us, because dates have good supply of this blood supplying nutrients. So I think that's God's way of telling people that you need to have an increment in your blood volume. So basically, iron sources, we in Kenya we have variety. I think I've mentioned a good number. When it comes to calcium, we also have the vegetables. People do not know that vegetables have calcium. We have omena. There's dairy, of course. If you cannot handle fresh milk, you can try yogurt. You can try, if you can't do fish, but you can, unfortunately, not everyone will hate fish. I know someone who used to love fish so much when she was pregnant. She would eat a lot of it. Now, maembe kali, mangoes are a good source of vitamin C as well as vitamin A, and they come in with the fiber, the juiciness, they keep you hydrated. So you're going to actually have a better supply of nutrients when you take them from holistic or dense foods. So when you're choosing your iron sources, please, because you're pregnant and you might be having limited intake because of, maybe you might be suffering from nausea, you might be suffering from all these complications of pregnancy, you need to make sure that you're selecting denser foods. So like something like an egg, if it's possible, you can boil it. I would actually encourage pregnant women to shy away from frying their eggs, because their rufu can be too much. So you can actually boil your egg, have it just like you can take it as a snack. A boiled egg as a snack. And then you can mix it with the kachumbari, the salad. Kachumbari has nyanya, and then if possible, you add an avocado. You'll have supplied your body with effective medium of utilization of that vitamin A in the nyanya, with the iron in the egg, as well as supplying your body with protein to take care of the increasing need due to the cell replication, multiplication, and division that comes up with being pregnant. So I don't know if I answered your question.
Yes, you have answered it in so many words, but point is home. So I'm seeing a few questions on the chat box. Somebody is asking, do you take IFAS before or after food? And kindly talk about dietary diversification and food groups. So I think you've talked about that diversification. So maybe just answer the question, do you take IFAS before or after? Just keep it under 2 minutes so that we can tackle the other questions as well.
For the medium of absorption, you're supposed to take it with food. That is the guidelines. You're supposed to take it with food so that it gives your body. Some people will actually tell you to take it on an empty stomach, but for best utilization, if your combinations are good, you should take it with food so that you can have the mediums, the other nutrients, the vitamin C supporting absorption and utilization. But if you cannot, you can just take your food. If IFAS induces vomiting, because someone might come to you and tell you, Mumina, you want me to take IFAS with food and it makes me stop eating. So you can take your food. And just before, digestion does not happen immediately in the tummy, because I'm hoping that as a pregnant woman, because constipation is very common in pregnancy, because you don't want to get constipated and you're pregnant, you need to make sure that you're taking care of your fiber intake, your water intake, and such. So I'm assuming digestion will not be so fast because your dietary practices will have fiber. Maybe you'll have taken some skuma or maybe some vegetable if you can do cabbage, or okra, or all these vegetables that we have, like briganya, all those. We have a good number of vegetables. So you give yourself at least 1 hour so that your what is it called? Not sensitivity, but I'm forgetting the word, but I hope you're getting me. That feeling like I want to vomit, nausea,
and all that.
If you get nausea after eating, you are supposed to give yourself time before you take the IFAS, because if you get nauseous and then you take anything else, kutoa ni rahisi,
Exactly.
So I recommend if you're that woman, me, I'm saying something that worked for me. I'll take my food, do like whatever I was supposed to do, 1 hour. Then after 1 hour or 2 hours, then I'll take my fast na naimeza mbio mbio sana. When I'm allowed to take water, because because of digestion hygiene, we recommend that you take water at least an hour after your meals, so that you can actually support the digestion, not like dilute your acids and your things in your stomach that you affect digestion negatively. For supporting digestion, you take it 1 hour. So when that time that I was supposed to do that, that is when I used to take my IFAS.
Okay, cool. So Joseph Coyne is asking, in his community, he's a Maasai, pregnant women tend to take fresh milk and ugali to avoid hyperacidity, which is induced by vegetables, for example, the tomatoes and kales. So can you discuss this nutrient interaction? Yeah.
Pardon, kindly come again.
So Joseph Coyne is Maasai, and he's saying in his community, pregnant women tend to take fresh milk and ugali to avoid hyperacidity that is induced by vegetables, the tomatoes and the kales and the likes. So he's saying that you need to maybe discuss the nutrient interaction.
When you take ugali and mala, is there any nutrient interaction there?
No, he's saying fresh milk, and they do that to avoid acidity from veggies. So he's asking to discuss nutrient interaction. Because you know vegetables have the iron, and fresh milk has calcium. So calcium and vegetable tend to gel, and iron will not be absorbed.
So they combine the foods.
Exactly. So
I thought you were saying that they take milk and ugali to avoid taking vegetables. No, that is it's a sad norm, eh? It's a sad state of affairs, eh?
Yeah.
Because most of us actually love that combination, whereby we take ugali, we do our vegetables, and we do mala or milk.
Yeah.
But unfortunately, as you have said, there are studies that have shown that negative nutrient interaction that actually hinder absorption of these two nutrients. That is calcium that you're looking to get from the mala, and iron that you're looking to get from the vegetables. So if you actually want to capitalize on those two different nutrients, why don't you just eat your fruits? You take your milk, and then you wait. Milk, milk is a bit is liquid. Yes, it has fat, but it will not undertake the digestion process that a vegetable would actually undertake. So why don't you take your milk earlier? And then if that's your belief that it actually reduces acidity, because sometimes I think placebo effects helps a lot. So that's your belief that it will help you with reducing acidity. You take the milk earlier, then you give yourself an hour or two, then you do your vegetables to avoid the nutrient interactions that are going to actually not get the benefits of both food groups. Because as a pregnant woman, you need them. You need calcium, you need vitamin D, you need iron, you need folic acid, you need all those goodness in both foods.
Correct. So I also think just to avoid the hyperacidity, you could take things like spinach, things like cabbages, things like broccoli, cauliflower with carrots, a stir fried of the veggies. All that will still give you iron. But what we are also trying to avoid is the nutrient interaction that comes with calcium and iron. It's the same point you were saying about taking tea after meals. So if you're looking for the balanced diet type of effect, then you'd have your ugali and your veggie that will give you low acidity. And then a few minutes after, you could easily now take your milk. And at the end of the day, you still have your protein for the day. So I think there's a way you can just speak to a dietitian, and they would easily advise you how to do the combinations so that at the end of the day, you're having your balanced diet without the hyperacidity. Because normally, a lot of hyperacidity will lead to cancer of the esophagus, cancer of the stomach, and we are really trying to avoid that. So just change the type of veggies, just do spinach is less acidic. If not, you can stir fry your veggies that you have, your cauliflower, broccoli, and I know that is not in the Maasai culture per se, but spinach is there, and then you can delay your milk and have it later on. Yeah. So I think the next question would be,
and also, maybe to reduce an acidity, you can also blanch.
Yes, yes, yes.
You can just like take your vegetables, dip them in like steam in hot water for like 5 or 10 seconds, then you remove and cook, and then you slow
Yes,
cook them in low heat.
exactly.
You make sure that they are well cooked but not overcooked. So you cook them and then you eat, because sometimes the acidity comes with the intake of really foods that require a lot of breaking down. So
Yeah,
if you experience hyperacidity when you're pregnant, again, dietitians are all over the country. Feel
true.
free to reach for one.
Exactly.
Mm.
So as a
Mm.
reminder as well, the chat box is again free. We are taking questions, so feel free to write up your question, your comments, your observation, anything you want to tell us. Just write it down and we'll read it out. Stella Simon is saying just yesterday she had a client who was 34 weeks and she was coming for the first ANC visit, and that
You
was quite
see?
unfortunate. So you can imagine the type of nutrients this
Mm.
child is, the deficiency that it has taken place already, and the catch up that we need to do as dietitians, even as the patient themselves. So I'm sure
And then we
Stella,
start
you did a
blaming
good
the
job.
mother-in-law.
Sorry?
Women, when the birth defects come in,
Yeah,
because I usually, people don't like to be told the truth. When you
yeah,
discover you're pregnant and you decide to take that pregnancy to term, it is your responsibility to take care of
mm,
that baby. So you cannot start saying that, I was scared. No, sometimes I know the changes are so much. They like hormones can actually overwhelm you, but the fact is you need to get yourself together to make sure that the baby comes out perfectly. Not
yeah,
perfectly, because you also have the Most High who actually guides on that. But
yeah,
when you discover you're pregnant, it is your responsibility as a woman to take care of that baby in your tummy.
true, true.
So please try as much as you can to accept that the sooner you discover, the sooner the better. Because when you start, maybe you did not plan for pregnancy, you had goals that you wanted to achieve, you had things
Yeah,
that you had to do. Now, if you start wallowing in that pit, it will
mm,
not change the fact that there's a baby growing inside you. So what you can do
correct.
is make sure that the baby comes out okay, you come out okay. Then after that, you can go back and start restructuring your goals. It's easier said
Yeah,
than
sure.
done, but it's possible. Yeah.
Yeah. So I'm sure Stella did a good job at advising that lady. And then we have Angela. Angela, she's saying, what's the best IFAS? Separate iron and folic combined as IFAS, or you do Pregnacare or Pregnacare Plus? What are your opinions on that?
Because you are not marketing any product at the moment, I'll
Yeah,
just bluntly tell you to look for a pregnancy specific supplement that has iron, folic acid, calcium,
vitamin
um,
D.
vitamin D, and if
Yeah,
possible, like a multi kind that comes with
yeah,
more iron, omega 3, and the DHAs and such. So
yeah.
if you can get one that you can actually take, because pregnancy needs change during the different trimesters. I might
Mm,
you might you might you might be okay with not taking an omega 3 or any fat, these fatty acids, any
yeah,
fatty acid supplement during the first trimester. But you see, the brain development starts during the mid to late trimesters. So you might actually need to ensure that you are taking care of that brain development part. So by taking up the fatty acids. So if
yeah.
this is possible, then, but again, if you don't know, how will you adjust? So we are not marketing any product. I'm personally not marketing any product, but make sure that you consult a dietitian and
Yeah,
you read. Please, let's normalize reading.
please.
Your influencer will come and tell you, oh, this is the best one, oh, this has this and this, but please
Yeah,
normalize reading, normalize even doing a small background check on a
yeah.
product before you start taking it and you're pregnant.
True.
Pregnancy is vulnerable. It's like
Yeah.
infancy. You're taking care of
Mm.
yourself and the baby at the same time, so you have to be very cautious with anything that you're taking in your mouth.
Correct.
That's my
So
take.
even as we see these pregnant ladies, we need to also normalize asking them, what supplements are you on? And can I actually see the ingredient list? Because you can find that people are taking maybe one supplement and taking a lot of that one supplement in so many other type of medications. So it's just easy to just ask the patient, what supplements are you on? Are you on any drugs or anything to help you with the pregnancy journey? And just try and accumulate or read through everything and see exactly what's happening. And if there's any deficiencies, you're able to guide accordingly. Just what Mburu is asking, what is the remedy for backache issues after pregnancy?
I just when you give birth, mimba ubebwa kwa mgongo. So when you give birth, you might experience backaches. That is a sign of, it can be a sign of you healing. You see, ukipona hiyo kidonda. Kindly excuse my background. I don't know what is happening, but we got pregnant. Yeah. When you discover you're pregnant after childbirth, that's a sign of deficiency, because your body is supposed to repair. You know, after childbirth, postpartum care is supposed to target repair from the impacts of pregnancy. You might not repair fully. The signs of having carried a child might remain with you permanently, maybe the stretch marks, but you can repair effectively your back, your everything else that was affected. It can actually be repaired, because when you're pregnant, the back issue can actually be because of the baby stretching you, doing such things to you. They kick you, they do things to you. You start having those complications. But after childbirth, they can be repaired. That is why it is important. I usually talk about the importance of postpartum care for the mother as well, as we support breastfeeding. You know, if you breastfeeding is it's nutrient dense. So if you're feeding and you're not taking care of your nutrition, before the baby gets malnourished, he or she would have sucked the life out of you. Correct. This is why you start experiencing all these complications of deficiencies, backache, mikono kucha kukatika, nywele kung'oka, vitu kupotea kwa mwili. So you need to make sure that you are taking care of yourself.
Yeah, true. Maybe the last question. Somebody is saying your sound is breaking, but I think you're perfect. So maybe Joseph needs to look at his maybe audio. Ayura Edina is asking. We are having a cleft lip palate medical camp surgeries in our facility this coming week. So the numbers we have recorded, or rather they have recorded, are huge and saddening. So she's looking forward to a time we will raise awareness on this malformation, and she feels like nutrition plays a major role. What are your thoughts around nutrition and cleft lip palate type of condition?
You know, as a country, we are achieving, maybe we've not achieved the indicators when it comes to food security that we want, but we are somewhere when it comes to creating awareness, encouraging people to produce. People are even trying to produce foods and plant food in their balconies and such, urban nutrition and such, urban farming, sorry. But unfortunately, the defects of malnutrition in the country are doing what? They are increasing. This shows there's a very big gap between the Kenyan population and the nutritionists. You see? Now, until we bridge that gap, we will continue to have people with birth defects because they have been told by these TikTokers or these WhatsApp gurus in wellness, because I am in those WhatsApp gurus and I see people being misled, and I'm really, really sad.
Yeah.
They have been misled that it's okay if you don't feel like taking your IFAS, just don't force it. We didn't and we came out okay. The minute you'll be queuing for the cleft lip, for the surgery, it will be you and your baby. That's one thing you need to remember, that the woman who was telling you not to take the supplement, that it's okay, she'll be at home sleeping with her baby who is okay. Unang'ang'ana na shida zako za kupanga line za recovery, sending so that your baby can go for surgery. So we need to make sure that there's a very big gap. That one I agree. And I don't know how we are going to force the governments, both national and county, to actually to actually help us bridge that gap. But as what we can do as mothers, or what we can do as women of reproductive age, once you discover you're pregnant, as I've told you, it is your responsibility to take care of that child that you're carrying. So try as much as you can to even once. You don't have to come twice. Just visit a dietitian once. Sit down with them, like ask all your questions, go with a notebook, ask word by word, what am I expected to have? When let's say you pay for consultation, let's say I pay for consultation with you, Joyce. When I come to your clinic and I'm pregnant, I can just decide to come with all the questions, all the needs, all the issues that I've had about pregnancy. You can prepare a list of what you would like your dietitian to actually address when you go for that consultation, even if it's for a first time. Of course, there are those issues like maybe if you're diabetic or if you're at risk of certain complications that you might actually need follow-up. So please do not shy away from doing that as a woman of reproductive age who wants to maybe reproduce in the near future, or if you discover you're pregnant. Because as Edna has said, the effects associated with malnutrition during pregnancies are serious. I know a few people on a personal level who've actually been victimized, and they were not victimized. They made themselves victims. Because I remember one of them, I will tell her, she was like, no, Mimi siwezi meza. It's not possible. That thing. And it was sad because it was her first child, and she was listening because is it sister-in-law? Yeah, sister-in-law had told her that those things are terrible and they will make her vomit, and how she didn't, and the baby was okay. Now you see her baby came out with deformities at the back here. So they had to undergo surgery at a very young age. Correct that. We thank God because of technology and advancement in medicine. But again, prevention is cheaper, because if she had prevented, IFAS is free in public hospitals. In these other facilities, it's less than 1,000. You can get 1,000 bob or less. Even if it goes high, like a pregnancy supplement, if it goes really, really high, it's 2,000 bob. Or if you want the crazy ones, maybe 3,000. But an average of 1,000 is enough. Per month. And you have your consultation with a dietitian and take care of yourself.
Great. So we need to close. It's 10 minutes past the hour that you were supposed to end. Under 1 minute, Mumina, I know you can't keep things below 1 minute, but under 1 minute, what is your parting shot so that we can close this under a minute?
Under a minute. Yes. Under a minute, I would like to encourage my fellow dietitians to try as much as they can to actually make sure that we are putting out the right information out there. I know sometimes it can be intimidating because you go to, let's say you want to do a live, you go for a live, and then you've come from, maybe you're so angry, but you've come from a live with a lot of people who are actually commenting on the wrong things when it comes to nutrition, and you're like, no, I need to tell people the right thing. Then you go to live, and then only 2 people, 3 people show up, and you saw the other person was talking about crazy information, had like thousands watching and listening and actually engaging. So we need to try as much as we can to overcome such, and try as much as we can to also make sure that we are talking about the scientific, and something that is actually going to help our masses. Because if you create continuously, if you get 3 viewers, 4 viewers, 5 viewers, one day they'll get to 1,000, So we get, we should actually try as much as we can. I've seen someone. Pole sijakuattack sana, is kidogo. But it shall be well. Small progress here and there, it shall be well. So, and for the mothers, when you discover you're pregnant, please do not shy away from going to clinics. Please avoid listening to the hearsays, because someone will tell you, me, I did not do any supplementation when I was pregnant and the baby came out okay. As Edna has clearly put it out, the list for surgery is really overwhelming. The defects, correcting defects in this country, then if you actually go to those clinics and see them, you will actually never even miss. You utajikaza hata kama, where there's a will, there's a way. If you ukiambia mwili yako, I'm going to take this IFAS, imagine you will. And if you cannot tolerate one supplement, we thank God we have different types of it. So have a dietitian, have a conversation with a dietitian. Don't be scared of reaching out to one. Reach out to one, have a conversation, and make sure that you're taking care of yourself. Because as I've said, it is your responsibility. Before it becomes my responsibility to take care of you, it is your responsibility to allow me to take care of you. So
Correct.
as a pregnant or as an expecting woman, do that for yourself and for your baby, and all will be well.
Great. So that for me, my parting shot would be as dietitians, as nutritionists, kindly let's walk into these clinics for obs-gyn, partner with them, see their clients as early as possible, and let us not shy away from reading. Remember, nutrition is a science. There's research happening every single day. Results are coming in every single day. People are publishing researches. So let's not shy away from keeping abreast with the current information. So we do this again tomorrow. So for tomorrow, same time, from 7 to 8, we'll be tackling not maternal, but child health. We'll go through child health, adolescence, and lifestyle diseases or lifestyle choices. Yeah, so see you tomorrow. Kindly let's keep time at 7 a.m.